There we go. Great. So welcome to our webinar, which is specifically for the Stickler community. If this is your first time participating in one of our events, we welcome you with open arms. I know that many of you were on our previous Stickler webinar, and we welcome you back as well. As you know, today's presentation is about living with Stickler syndrome. We'll hear about recently published data and then 3 personal perspective stories. You are not on this journey. You're not on this journey alone. There are others who face similar challenges, and we all learn from each other. So I wanted to introduce our CEO, Michael Weimer, but he got stuck in another meeting. And so that's what he looks like. Not here today, because as I said, he's stuck in another meeting, but he's really been a driving force behind bringing the Stickler community into the fold of the Marfan Foundation. You will find us hopefully warm and inclusive, and we really care about what matters to you, and we need to hear from you about how we can help you best. So I know Michael will be excited to meet you when he does. We had a small gathering at our conference in Atlanta this summer, and Tyler was with us there, and it was really great to meet some of the families. Again, we all want to hear your stories and hear what's important to you. So I'll tell you who our speakers are, and then we'll get to the presentations. First, we have Taryn, whose name I'm going to butcher, but she said it's okay. Taryn Yusufian Blackspat, who's a clinical psychologist at the TRS National Resource Center for Rare Disorders in Norway. TRS gathers and disseminates information about rare congenital, skeletal, and connective tissue disorders, spina bifida, and limb deficiency. And from our work in uncommon connective tissue conditions, we know that overcoming the mental health and quality of life issues are as important as the medical aspects of these conditions. People in our community tell us that they sometimes just want to feel validated. And so we're looking forward to hearing about Taryn's research today. Then we will have our personal perspective speakers. I'm not going to tell you too much about them because they are going to talk about it themselves. But we're going to hear from Tyler, who lives in Washington, D.C., Irene, who lives in Italy, and Emily, who lives in North Carolina. I will let them tell you about themselves when they're up later in this webinar. If you have medical questions, we're not really going to be dealing with medical questions here. Marfan Foundation does have a help and resource center, and that's Steph, who is the head of it. And you could submit questions to marfan.org/ask. Going through that website is really the best and fastest way to get answers from Steph and her team there in the help center. There's like 3 of them. So now I'm pleased to, oh, and then again, the Q&A box is where the questions go for our panelists. So I'm going to introduce our first speaker. I'm going to stop sharing my screen and ask my personal perspective people to shut their videos off, and we will just hand it over to Taryn now. Can you share?
Yes.
Okay.
Okay, do you see my screen?
Perfect. Thank you.
Yeah, perfect. Okay, thank you for the invitation and the introduction, Eileen. Tonight I will talk about a project we did at our center on the quality of life in Stickler syndrome. So we will go through just a short background for the study and also the methods that we used, because we did use 3 different methods. And then I will present the most interesting part with a selection of the results. So the story started in 2019 when we started to build knowledge about the syndrome at our center. And then we found very few publications on stuff like quality of life, the psychosocial aspects, education, work, and all the stuff that's not like strictly medical. So then we decided in 2023 that we wanted to initiate a study on quality of life in Stickler syndrome. So our main goal with this study was to find out more about what it's like to live with Stickler syndrome. So to explore this, we decided to use 3 different methods. One part is the scoping review. In the scoping review, we reviewed all relevant literature in, as I said, like the psychosocial aspects, quality of life, and everything that was not like strictly medical and genetic, to get an overview of what was out there. And then we also decided to invite families with Stickler syndrome to a special type of course where we gave the families the information that we had about Stickler syndrome, and where we also invited them to fill out a questionnaire asking them about the quality of life, satisfaction with life, demographics, their contacts in the healthcare and welfare system. And then also they got the opportunity to join in on qualitative focus group interviews. So, moving on to some of the results. For the scoping review, we found in total 5 articles mentioning something about pain, not necessarily the main topic for the article, but mentioning pain at least. And 4 of these are at least 24 years old. And one of these articles also measured quality of life in children. It's a Spanish study from 2022. So this was surprisingly little, even if Stickler's is a rare disease. This was very few publications, so we saw a need to gather more information. And then for the quantitative questionnaires, we had 24 adult respondents. So all adults at the course wanted to join, and they were between the ages of 19 and 72. It was 8 men and 16 women. And 25% were single, 62.5% had a partner, and 12.5% were divorced or separated. And the median age for receiving the diagnosis was 34 years, so quite late in life. And all of them had some kind of visual impairment in varying degrees. And then about 80%, 20 people, had some kind of hearing impairment. And then all except for one had some kind of skeletal issues. And as for work, the big majority, almost 50%, worked full-time. A couple worked part-time. 17% received disability benefit. 13 were retired, and then a couple of them were students. And as for education, they had quite high education. 38% had a bachelor's degree, 21% had a master's degree, and then the rest had vocational education at the upper secondary level or a general studies program. And then we asked them about the pain, and 92% reported pain that had lasted at least for 3 months during the last year. And we also asked them about pain onset. And the big majority said that their pain had started in the early years. 7 people said that their pain had started before they were 10 years. And then 10 people said that their pain had started between the ages of 11 and 20. And then only a few experienced that the pain came later in life in adulthood. And then we also asked them about the pain location. And as you can see, the most frequent locations were in the neck, with 75% experiencing that. And then 70% experienced pain in the knees, 62.5% in the lower back, but also a lot of pain elsewhere in the elbows, shoulders, wrists, hips, ankle, feet, upper back. and a lot of them had pain in multiple pain sites. And what's interesting is also that in the older studies that I told you about that mentioned something about pain, when they mentioned something about pain location, they often mentioned the back or the hips, and nothing about the neck, which was the most frequent location in our study. And then we also asked them what contacts they had had in the health and welfare system related to their Stickler diagnosis in the last year. And almost all of them saw an eye doctor, a lot of them saw an ENT specialist, and 75% had received genetic counseling. But very, very few had received any follow-up from mental health professionals or occupational therapists. And then we use the instrument Promise 57 that measures health-related quality of life in different type of domains, such as symptoms of depression, anxiety, sleep disturbance, participating in social life, and etc. And when we look at the most frequent issues reported, we saw that 42% reported pain interference at a moderate or higher level, and then 1/3 reported a moderate or higher level of fatigue, and then 29% reported a moderate or higher level of anxiety symptoms. And I will get more into this later, but in the interviews, we also got some hints on what these anxiety symptoms could be about. And it turned out that it was about a fear of vision loss because of retinal detachment, or a general fear of their health declining. And then we also saw an overall reduced quality of life compared to the Norwegian general populations in the other quality of life instruments. And then we also did qualitative focus group interviews during the course. And the results from the scoping review and the quantitative questionnaires, they are published. And the results from the qualitative focus group interviews are not published yet, so I can't reveal too much, but I will give you a little sneak peek anyways. So we saw that also in the focus group, like in the questionnaires, they reported on pain and fatigue as important issues. And they also told us that they received better follow-up for vision and hearing compared to fatigue and pain. And as I said, retinal detachment was a big worry for many of them. And they also talked about challenges at the work, but also solutions and adaptations that had helped them. And as we saw in the demographic results, a lot of them worked, so this was an important topic for many. And they also talked about how the syndrome had affected their relationships with others, like siblings with the diagnosis and without the diagnosis, and with their friends and other family. And they also shared that many of them already had children before they knew about the diagnosis, because the median age of receiving the diagnosis was 34 years. And they told us about struggling with guilt or worries about passing the condition on to their children. And they also shared that because they received the diagnosis so late in life, they were often misunderstood as lazy or uninterested because of fatigue, for example, before they received the diagnosis. And they also shared different ways of coping from personal coping strategies. And also, they told us about seeking professional psychological help and their experiences with that. And I would also like to highlight that this is a group with many resources. They work, they had higher educations, families, children, and they also had a lot of coping strategies. Um, and yeah, so that was a small sneak peek of what we found in the interview data. And we have written a paper on this now that we will submit to a journal soon. So it will hopefully be published next year, and I will let you guys know when it's published. And I would be happy to present more of the interview data when it is published and share quotes and go more in depth. And if you want to read more about the results from the scoping review or the questionnaires, then you can read the article in full text through this QR code. And I have also written a short English summary at our webpage and also a Norwegian summary at our webpage. And you can also find that through the QR code. So I would be very interested to hear from the rest of the panelists and also you guys if any of this resonated with you, or if you could relate to any of these results in any way. So yeah, feel free to share.
Thank you so much for that. Just really highlight some of the things that we've been hearing about the need for early diagnosis so that people can make better decisions about their families and can deal with life better. And your statistics on the whole pain piece. I mean, that's also really, really valuable. I don't need to say anymore. I want to start with Irene. Let's hear from the different panelists, and then we can get some questions from the people who are participating. So maybe you could stop sharing, Taryn, and then we'll just have, there's Irene. I will hide myself.
Thank you, Eileen. Can you hear me? Yes.
Yes.
Good afternoon. Thanks. Good afternoon, everyone. First of all, I want to thank Eileen from the Murphan Foundation for inviting me to be here today. It's truly an honor to be part of this important event and to share our family story with you. We're very happy that the Murphan Foundation also supports the Stickler syndrome community. My name is Irene Panizzolo. I'm Italian and I live in Cumiana, which is a small town near Turin in the north of Italy. And I'm truly honored to be here with you today as a mother, not a doctor, to share the story of my daughter Stella, who is 8 years old and was born with Stickler syndrome. When Stella was born, we had no idea she had the Stickler syndrome. Her condition is not inherited. It's a new spontaneous mutation, what doctors call de novo. But discovering that took a long and difficult journey. In Italy, almost no one knows this syndrome. We went through countless medical visits, seen many specialists who couldn't give us answers. And we knew something wasn't right, but we didn't know what it was. And finally, thanks to our wonderful pediatrician, Dr. Panfani, we were referred to Professor Nucci in Milan, Italy. And I still remember that day so clearly. He took one look at Stella's sweet little face with her tiny saddle-shaped nose, her huge, beautiful eyes, and he immediately said, I think she has Stickler syndrome. And a few months later, the genetic test confirmed it. And since then, life has been a journey full of challenges, but also full of courage and hope. And because of her very high myopia, Stella started wearing contact lenses when she was only 6 months old. And it was incredibly difficult at first. Imagine trying to put lenses on a tiny baby. And we knew it was the best choice to help her see the world clearly. So every evening we would take them out and replace them with glasses and making it part of our daily routine. And when Stella turned 5, she began wearing hearing aids as well. And even though she had been in speech therapy for a while, she still spoke like a much younger child. Today, she's 8 and she continues speech therapy once a week because there are still some sounds she struggles to pronounce, but she's improving every day and she's so proud when she learns a new sound. And for her eyes, we've continued to work with Professor Nucci in Milan, in Italy. But however, after some early signs of retinal problems, we were referred to Professor Martin Sneed in Cambridge, in UK. And 2 years ago, Stella underwent a preventive cryotherapy surgery on both eyes at Addenbrooke's Hospital in Cambridge. And it was a very tough and invasive procedure. And seeing your child go through that is never easy. But we knew it could help protect retinas in the long term. And in Cambridge, we're also followed by joint specialist Dr. Bale. And because Stella, like many children with Stickler syndrome, like we just heard, has a pain in her legs and joints. She's a brave little girl. She swings, she does gymnastics, she moves carefully, but of course with joy. And she also plays the piano, and music has become such an important part of her life, and it helps her express herself and feel confident. For her hearing, we're followed by Professor Canale in Turin, here in Italy. Syndrome charity. Stella had the chance to meet other kids with Stickler just like her. In Italy, there is still no Stickler Center. There is no national reference point, but we are trying, hopefully, to change that step by step. I created myself an Instagram account called Stickler Syndrome Italy to help connect families, to share stories, information, and hope. Through that network, we've met so many wonderful parents, all doing their best, just like us. We're also raising some funds for research, supporting Dr. Sneed and his team at Addenbrooke's Hospital and the charity in UK, because we know that every small effort can make a big difference, not only for Stella, but for all the children with Stickler syndrome around the world, and also for adults, of course. To raise funds, my husband Sandro ran the half marathon in Barcelona in early 2025. It was his very first one. He had never done this before. He also ran 10K in Turin and is now trying for the half marathon in Lisbon in 2026. And Stella also wanted to contribute, and together with her grandmother, she crafted and sold handmade bags at the local market here in Cumiana last year. Well, just to end, Stella teaches me something new every single day about resilience, about joy, about how strong love can be. Stickler syndrome is part of our lives now, but it doesn't define who she is. She's bright, funny, creative. She's full of dreams, and we believe in her future with all our hearts. And I would like to kindly also invite you to follow us and subscribe on Instagram at Stickler Syndrome Italy, and also in the UK at Stickler Syndrome UK. So thank you. Thank you so much for listening to our story. And thank you to all of you, doctor, researchers, and families for the incredible work you do to raise awareness and support. Together, we can truly make a difference. So thank you so much. Over to you, Aileen.
Thank you so much, Irene. I just want to thank you because you've been such a great resource for us at the foundation, connecting us to people, connecting us to doctors. I've spoken with Professor Sneed, and he is just wonderful. I've spoken with Ian, who's the head of Stickler UK, and I think we're all going to really be working together to do what we can for this community. And listening to you and listening to the concerns of the other people here is really going to help us as we move forward. So there were some questions, but we will get to those afterwards. And I will put up your Stickler Instagram page later, as well as Emily's Facebook page, so everybody can see those and follow you guys as well. So at this point, I'd like to bring Emily up And Emily, if you could tell us your story, that would be wonderful.
Alrighty. Hi, everyone. I hope you can hear me. I want to start this off by also thanking the Marfin Foundation for countlessly inviting me in, being able to talk and share my story, because mine is probably one that a lot of you can relate to, but at the same time, it's a bit of an odd one for here in North Carolina in the United States, where we have several research hospitals who actively specialize in Stickler syndrome. But I myself have Stickler syndrome as well as a lot of comorbidities, and then I have two sons who also have Stickler syndrome. So my story with Stickler syndrome began the day that I was born. Though it took decades to get answers. I was born with a small jaw, as we all know is Pierre Robin sequence, low set ears, and a severe cleft palate that made it nearly impossible for me to eat. As I grew, new symptoms would continue to appear, like progressive hearing loss, severe nearsightedness, and joints that just seemed to injure just far too easily. And I was quite the rambunctious child. But no one really ever tried to put the pieces together, just like other people have related to. I was one of those children that they brushed off as being lazy, dramatic, clumsy. It wasn't until I became a mother myself that the puzzles pieces finally started coming together. When I had my first son, Oliver, I had a lot of complications with my birth, which landed him in the NICU. And by chance, he had a cleft palate, similar facial features, and a geneticist just happened to walk by after visiting with another family. He stopped, he looked over at my son in the cot, and he asked if he could come speak with us. So we invited him over, and right off the bat, he said, I think I know what this is. I think it's Stickler syndrome. And me and my mom were just shocked. And so he turned on the overhead light and he's like, now that I'm looking, I believe you have it too. And that was the start of what led to us finally getting answers for a lot of things that had been happening in my life. After a few months, he finally got genetic testing that did confirm that both my son Oliver and I had Stickler syndrome. And after years of being dismissed, that moment was bittersweet. It was kind of equal parts grief and relief. It was grief because my son would face similar struggles that I did, but at the same time, I felt relief because we finally had answers and maybe there was something we could do about it. 4 years later, I was pregnant again with my second son, Nolan, and his birth, too, was a little rocky, but this time I was prepared. Through amniocentesis, we confirmed that he also had Stickler syndrome before he was even born. It was emotional knowing what challenges lied ahead, but it also gave me a chance to be proactive. I was able to build a care team for him before his birth, plans for feeding and support in case he had a cleft. He did, and advocate for him right from day one. So when he was born, he ended up going directly to the NICU at Duke Children's Hospital, where he received a feeding tube placed at 2 weeks of age and then a trach right at 2 months of age. He finally left the NICU after 98 days total. Being a parent with Stickler syndrome and raising two children who also have it brings its own set of challenges, physically, emotionally, and medically. Some days it's managing vision appointments for all three of us. We all three end up seeing Dr. Vashovich, also known as Dr. V, at the Duke Eye Care Center in Durham. She is fantastic and is very familiar with Stickler syndrome. And then other days is trying to conserve my own limitations with energy while still showing up fully as mom. There are moments when we all need braces, glasses, mobility aids, or anything else all at the same time, and the house just kind of looks like a small medical supply store. But we choose to smile and we make it work. Each of us faces different symptoms of Stickler syndrome. For me personally, it's mostly vision and mobility issues. I do have hearing loss, but I'm still able to adapt due to early intervention and the use of small hearing aids. For Oliver, it's vision and joint hypermobility challenges. And then for Nolan, it's breathing difficulties, pain, and fatigue. But together we've learned how to adapt. We celebrate small victories like when one of us gets through a full day without joint pain, or when someone gets a new pair of glasses that actually help them see clearly. For me personally, mobility has changed a lot over the years. My joint and spinal issues eventually made walking long distances too painful and unsafe. So I now use a wheelchair. But that wheelchair doesn't hold me back. Instead, it gives me freedom. It allows me to keep up with my boys, to go to their events, and to live life fully. My sons see it as normal because in our home, adaptive tools aren't symbols of weakness. Instead, they're symbols of strength, resourcefulness, and, of course, love. There are hard days like surgeries or flare ups, and the frustrations of just navigating a world that just really doesn't seem to understand invisible disabilities. My goodness. But what gets us through is support, community, and purpose. I started my blog, Life with Sticklers, to share our experiences and raise awareness. Since then, I've connected with families and doctors across the world who've said our stories have helped them get diagnosed or feel less alone. That connection, that spark of recognition, is everything to me. When my sons were first diagnosed, I was scared. I had looked up online trying to figure out more about Stickler syndrome, and really, there was nothing. All I found was a few pictures of Dr. Gunnar B. Stickler, and then a few pictures of just the same generic little boy who had Stickler syndrome. And really, with that, there was no personal experiences. There was no stories about surgeries. There was no treatments. There was no mobility aids. All these things that we actively have in our life right now, I could not find any information on. So I decided to be that resource for other people so that they have someone else who can relate to. They could ask questions. But living with Stickler syndrome has taught me that strength isn't about never falling down. It's about finding the courage to rise again and again, even when your body makes it hard to stand. My boys and I may feel what some call a rare diagnosis, but we also share something even rarer: resilience, understanding, and hope. Stickler syndrome will always be a part of our lives, and it doesn't define who we are. We are a family built on determination, compassion, and love, and we're providing that every day when we choose to continue with the challenges that others can't see. We try to build something more beautiful together. Thank you.
Thank you so much, Emily. It's just it's great to see you on here. I can't get my camera back on. It's great to see you on here. You write to me and you tell me what you're going through, and I read it on your blog, and then I see your presentation and the way you deal with things and the way you look at life, and it's just really it's I don't even know what the right word is. It's motivating, it's hopeful, you're a great role model for people, and we really are grateful to have you as a great resource for the foundation as we kind of work to catch up with you and all you've been doing for the Stickler community. So thank you so much for that. And we have some things that we will talk about afterwards to address some of the questions that are coming up. Um, I know I see my colleague April Dawn in the chat box sharing some of those links right now. Some of them I'll be talking about later. She does point out we have a session coming up on empowered relief to deal with pain management. So check out that link that she posted. So thank you for doing that, April Dawn. Now I'd like to introduce Tyler Roberts, who is coming to us from Washington, D.C. Met him at Congress randomly several years ago. And he really was my first introduction to Stickler syndrome and has helped me along the way, helped us with our group that we had in Atlanta at our conference this past summer, and has really been a leader for us in the Stickler world. So now we will turn to him.
I don't know how I'm going to follow Emily. That was incredible. So inspiring is certainly, a word that came to my mind. But thank you, Eileen. And again, also thank you to the Stickler Foundation family. I've got to know them very well over the last probably 5.5 years, as Eileen mentioned. Serendipitously met them up on Capitol Hill. I live in Washington, D.C. Spent many years of my career on Capitol Hill working on healthcare policy and just happened to see the Marfan pin on Eileen's lapel, and the rest is history. But, as I mentioned, my name is Tyler Robertson. I'm 43. And I have Stickler syndrome. This is something that I have been, part of my life since birth. I was diagnosed basically at birth. I had the Pierre Robin sequence as well, or do, as mentioned by Emily. I had a severe cleft palate and went through, many surgeries. As a child, I had a trach that I had up until I was about 2.5. But something, Stickler was something that fortunately my parents knew ish about because my dad, his grandfather, were suspected of having it. So I was closely watched, as a child. Lived mostly a normal childhood, but again, things creep up on you later in life. And Sticklers caught me in more adulthood, my senior year of college. I went to college in Chicago. It was my final semester of senior year, and I started having symptoms of a retinal detachment. And I had always been, very much educated on what that looks like. So I went to the doctor, explained it, but kind of got brushed off. And a day later, my retina detached, and I had to go home for emergency surgery. So, I think a big part of that is trust yourself. I think we are so, far beyond when I was born, with experts that are out there on this, knowing what to do, what to look for, that didn't exist necessarily when I was a child, or later on in life, even when I was an adult. So my symptoms have primarily been vision. I've had about 15 to 20 eye surgeries over the course of the last, 20 years since this all happened in college. I am mostly blind in my right eye. I don't say that to scare anyone. I'd say that to, pay attention to your symptoms. But this is something that I live with, and has been, a big part of my life. Getting to know other people in the Sticklers community, doctors, making sure that you look around to find those experts. I was fortunate to have parents that were able to help me, navigate that, even when I was in college. So, had my surgeries at the University of Iowa, at the Charles Retina Institute in Memphis, Tennessee, which is a really top eye hospital. And now I'm seen by strong doctors out here on the East Coast of the United States. So I think what's great about the Marfan Foundation and us sharing our stories like this is that we can, you know, uh, collect knowledge and collect, contacts to make sure that those out there have a chance to, no symptoms, no doctors, and where they can go. Um, other things that are super important, in my journey, I do have some, achy joints, but for the most part, have been, mostly visually impacted. I did have symptoms starting to impact my left eye a couple of years ago. So I had, as was spoken about earlier, cryotherapy on my good eye. I ended up having to have vitrectomies in both of my eyes over the course of the last 20 years. to make sure that I retain vision. And thankfully, through great doctors and support, I have, 20/20 vision in my left eye, and I'm looking to keep it that way. But there are certain things that have impacted me. I do have surgically induced glaucoma now, so something that I have to keep an eye on, knowing that my left eye is my dominant eye. But something that is certainly treatable. But I see my doctors every couple of months just to make sure things are where they need to be. And I say that again, as treatments are out there, new treatments are out there every day, new surgeries. It's just an incredible time that we live in. That so many people in the past, hearing my father and my grandfather's story back in the 60s, is really scary. And we live in a time that is advanced medicine. And something that's really important to me, beyond sort of medical support, is relying on the Marfan Foundation for all that they do. As Eileen mentioned, I spoke at the conference, or to a group at the conference down in July, about my Stickler story, but using this to get to know others in the community. This is amazing that we have this technology that everyone around the world can be on this webinar today, sharing their stories. So use the Marfan Foundation; they're a great resource, and I know through friends. Everyone that's on this call today, that will continue. So, again, happy to answer any questions, but just want to say that life is good. I know people are scared for their children, but I'm living a pretty good life, and I know you will too.
Great. Thank you so much. And I did not pay him to say any of that. But glad to hear that we've been of help to you so far. But I really want to emphasize what you were talking about, Tyler, is that about collecting knowledge, because that's what we're doing here too. We're collecting knowledge from all of you who are sharing your stories with us and telling us your concerns. We also want to share your knowledge on the specialists who you believe really know what they're doing with Stickler, and who are interested in learning more. I like to ask all our panelists to come back, because I have a few questions here that I've kind of been picking up from the chat box, and things that kind of resonated that I thought we can all talk about. So Emily, Taryn as well. Everybody wants to come back. Let me change my view here so I can see you all. So I mean, one thing that was brought up, you all talked about, meeting other people. And I guess I wanted to start with Irene. So, with your daughter meeting other kids with Stickler syndrome, why was that so important? And how did you see that it affected her?
Thank you, Eileen. Well, she had the chance, as I said before, to meet other kids in the UK, because in Italy we haven't had the chance to do that yet, unfortunately, hopefully soon. So it was really important for her, because she was really excited to meet the other kids like her, that looked like her, wearing contact glasses and hearing aids, with the little nose and these big eyes, and the problems with mobility. So she was really happy to know that someone else out there was like her. So it was really important. And since she actually met other kids and other also adults that looked like her with the same issues, I noticed that she felt more confident to speak about Stickler, that she hadn't done before that. So that was really important for her.
Yeah, thank you for that. Emily, what about your boys? They've grown up knowing about it, and have they met other kids with Stickler?
Well, by chance, we met one other kid, but I would say it was more of an infant. He was about 15 months old or so, so he just started walking, couldn't really talk much, but the boys took to him during their appointment and they played the whole time, and I actually kept in contact with that mom. But other than that, we really have yet to see many people down here that look like us.
We're gonna have to work on that, won't we?
Yes.
I have a question for Tyler that came in from Tina, who's one of our participants here. With your personal, let me just read this first. Let's see. This is about pain medication, and also based on your personal experience in government. Um, there's this opioid epidemic, and at the same time, there's people with chronic pain. I know we've actually, I think when we met with you, when we met you there, we were advocating for sensible, pain medication regulations, because some people
Yeah.
actually do need those, and so the pain gets to be more of a problem later in life, or increases during life. So, what's your view? You have the political experience, but in terms of opioids, pain management. Do you have any thoughts on that?
Oh my gosh, this is right up my alley. So thank you for, you know, I have worked on this issue for probably a decade. I worked for most recently a senator from Alaska handling health policy. And what is happening, and then, I've left the Hill, and I work on behalf of some pharmaceutical companies. There are treatments coming out. Vertex Pharmaceuticals out of Boston has a non-addictive painkiller that is out on the market. Sutragine, I believe is what it's called. But certainly, want to say for chronic pain, people going through, Emily, your story, people going through cancer, I think opioids are such an important part of treatment so that people can get up and go on with their life. There are drugs out there that they are trying to do that don't have those necessarily addictive qualities. Those are more, I think, the legislation that I've worked on is more in the acute setting. So your son goes to get their wisdom teeth out. They're not put on, 90 Percocets and then suddenly have an addiction and they're on heroin and they've died. So I think, to your point, opioids are incredibly important. I think they have been unfortunately demonized, you know, during the opioid epidemic. There have been some serious problems, but I think I would say, and everyone should rest easy, that any sort of legislation on Capitol Hill is not an opioids grab. It's not meant to take those pills away. It's just to say, hey, we were looking at alternatives, and it mostly falls in the acute setting. So you have a cesarean section or a foot surgery, instead of going on opioids, you could go on these alternatives. But I think it's all about personal choice, and I'm not a doctor, so but yeah, so I think view it as very important as someone that's worked on health policy for years, to have access to those, but that there are new treatments coming out.
And I also want to point out a couple other things. I mean, April Dawn did post in the chat box about Empowered Relief, a webinar we have coming up. There's so many different ways to approach pain and pain management. One of the best talks I heard on it was from pain specialist from Johns Hopkins, who talked about the goal maybe not being zero pain, although we'd all like zero pain. Everybody with or without a condition would like zero pain, but really about function and what are you trying to accomplish during the day? And everybody's, pain tolerance is different. So, the answer might be prescription medication. It might be something that's not prescription. It's just some, something, some other kind of behavioral therapy kind of things, or a combination of the two. But I think it's really about, what is it you want to accomplish, and then talking with your own doctor and your own, maybe even mental health professionals, talk about ways that you can confront it. Emily, what do you have thoughts on this? I know you have some issues, some experience in this area.
Well, I've tried several different things, and since I too also deal with chronic fatigue, I look at it probably at a slightly different standpoint. Although I would love for my pain to be gone, I simply would not be able to function if I had something that just kind of brought me down, which is what really led to us using a wheelchair and mobility aids. It took enough pressure off my spine and my legs, and on top of the generalized weakness from other comorbidities and other issues you've read on my blog going on, um, it seemed to have been the best option for me. Um, for short-term relief, I do ask occasionally for pain management, but really, we haven't found anything that works well for me. I just simply do not like that just groggy feeling. I feel like I can't function. um for like muscle and joint pains, for just kind of over the counter, I've tried Tylenol, but of course we've all been there. Tried heating pads, a lot of the usual stuff. I even went to the extent of, after both my knee surgeries, of buying my own TENS unit. And while that does help temporarily, it's still temporary. So I really do think that we need to kind of look more into it. Maybe there are other options and avenues that we could discover for other stickler patients that could potentially lead to pain relief without that groggy feeling.
It's interesting putting all these connective tissue conditions together under our umbrella. There's a lot of joint, joint pain, progressive joint pain as people get older with these conditions. So, we can put all our knowledge together. I mean, Taryn's study, validating it. I saw somebody wrote in the chat that it's validating. And I think that's the first thing so that so that medical professionals don't think you're lazy or don't think you're making it up because you don't look like a typical old person with pain. I mean, I think that is a huge first step. And that's what got me excited about what Taryn was doing and the results that they have. So it's a process. And somebody else asked about orthopedic specialists in the US that specialize in Stickler syndrome. And, we're looking for those specifically on Stickler, but at the same time, we have joint and bone and joint doctors who are interested in connective tissue, who are familiar with Marfan, Loeys Dietz, and I'm sure they have some Stickler knowledge too. So, Merritt, if you're looking in the US, I know you're in Norway, but if you're looking in the US, contact our help center and that URL up again. But our help center can help answer that as well. Somebody else asked about coping strategies, and she didn't specify what kind of coping strategies, but I thought as our last question, I'd throw out to everybody. So coping with this condition, let me ask each of you, what has been the biggest challenge, and then how have you coped with that? So I'm going to go to Irene first. I know, I'm just throwing it at you.
Difficult question. Well, as a mom, you mean, or for Stella,
Yes.
well, it's difficult. Well, my biggest challenge was not to know what she had when she was born, because when also Emily was saying that she had no idea what she had. So when you don't know what you have, that's a big challenge. Once you know, well, at least you know what it's about, and it's easier because you look for information, even if you don't find it, but at least you start working on something. So the biggest challenge was at the beginning, not having an idea on, also, let's talk really when she was born, we had no idea also of her life expectation, because we had no idea what kind of syndrome she had, because they said, oh, she has something, but we didn't even know if the life expectation would be normal, lower. As you know, some other syndromes also have a lower one. So for me, also knowing that at least the life expectation was normal and the problems were a lot, but they could be different, was already a relief. So that's our personal experience.
My perspective on what you've done, like you are like the perfect example of knowledge is power, because I know that you've gone out there looking for the specialists and have really become a great advocate for your daughter and finding those specialists and connecting with people. So, it's not easy to do that. I know when you're working and probably have other kids, and so take care of yourself and everything too. So, you're a great example to people, and take care of yourself too. Tyler, what about you? What's been your greatest challenge and how have you coped with it?
I think just the general, obviously I've had vision stuff and that's just par for the course. But I think that the biggest thing, and Emily touched on this, no, Emily, I'm going to have to go explore your blog. So I'm really excited about this. Is just the lack of awareness and knowledge around Stickler syndrome, that people, luckily my parents like somewhat knew and I was like watched. It still didn't help when my retina eventually detached. So I think it's that lack of awareness. So and how I cope with that is jumping in with you guys. I'm a big fan of advocacy. Write your members of Congress. I know it seems like a weird time in politics, but like educate people on this. Educate your doctors. There are materials I know that Marfan Foundation puts out on what sickle syndrome is, because so many people just are unaware of it. And I'll share a very quick story. I had my first big eye surgery at the University of Iowa in 2005. Had it with a renowned doctor who has since retired there. But there were a lot of sort of apprentices in the room at the time. And 10 years later, I'm working on Capitol Hill, and this man comes in from Alaska. I'm not from Alaska, but he came in and we talked. He was an ophthalmologist. He did a lot of eye surgeries, and then he looked at me and we started talking about somehow got into Stickler syndrome, and it turned out he had been one of those apprentices in that room of my surgery a decade earlier. And what he said he learned from just how sort of bad my situation was at the time, is that he used all that knowledge and he had like, jumped into learning about sticklers and now like has made that part of his practice. So I think I share that just in like, you never know what's going to happen. I believe in happenstance and fate. But educating people can really change lives I'm so glad to hear Irene and Emily, your children have, access to a lot of things that, back in 1982 when I was born didn't exist. But to continue to educate and advocate for not just sticklers, but for yourself and for your family. So
And you all sharing your story is just that. And I do encourage anybody who's listening to this webinar, if you would like to share your story too, get in touch with us, and you'll save a life. You will help people live better and longer with your experience and sharing. You don't have to share everything. You share what you'd like to share, and everybody learns something from somebody else. Emily, let's go to you before we close this part of the session.
So Irene and Tyler made wonderful points, awareness and connection and research. For me, the biggest struggle would be all of those, but adding all of the hidden oh goodness, I can't talk today. Invisible disabilities that can come along with sticklers. The general public really just will look at someone like me and just see the glasses. They won't even notice the hearing aids, or if I wasn't in my wheelchair, they would think that I was perfectly fine when in reality, I probably need a lot more assistance and accommodation than what you would just see. So I think that's where going into the research, kind of learning about this, being able to express our stories and being able to have other people's experiences and connecting with doctors who understand us more all ties in together so that we can kind of overcome at least the challenges that we can, and it will be a little more accepting and understanding from the general public standpoint that, hey, maybe they do need a little extra help. Maybe they do need this blue badge for parking, or this white cane for walking, or they do need this wheelchair or the hearing aids or whatever else that someone needs to accommodate to live this normal life.
That's a really, really great point. Thank you so much, you guys. That was really good. I want to just share some more resources from the Marfan Foundation so that people can walk away with this with some more resources. They've obviously heard your personal stories, which totally helps because then there's other people like them and they hear firsthand what that's like. As I said earlier, and one of my colleagues put this in the chat box, our Help and Resource Center is there for you. Go to that website, marfan.org/ask, and Steph and her team at the Help and Resource Center can help answer medical questions. If they don't know, they'll go to a specialist. They can tell you about the doctors we know about in your area. They're really a lifeline for our communities. So please use that, please. We do have a virtual support group, and I know one of my colleagues, I think April Dawn, put that in the chat box as well. It's the first Wednesday of the month at 8 o'clock Eastern time. So if you are in Europe, just take a nap, and then you can do this at the middle of the night for you. And that is the link. We will put these links in our email following up this webinar. And I don't know if you see our little icon there. We are embracing Stickler as as a Stickler movement, part of the powered by the Marfan Foundation, and you will see that more and more as we grow this community and continue to provide programs and services for you. Being part of the community here's this great opportunity for you all, and Emily and Tyler have both been really involved with this, with our Walk for Victory program. There's 24 walks in cities across the US. It's a fun day for individuals, families, and friends. It's not your typical walk. It's not like we walk 5K or 10K. It's more like a ceremonial walk around maybe a lake, and it's more of a family festival with face painters and music and food and lots of fun things for the kids. A great way to meet other people in the community, bring your friends to support you. I mean, how exciting. It's not like one of these conditions that's huge, but here we have these relatively uncommon conditions and there's an event for you. And you'll also meet local medical experts who are sponsoring, and so it's a great opportunity to get together. At marfan.org/walk, you can see where all the walks are. You can even lead a Stickler team. We have Lowy Seats teams, Veds teams. I know Emily and I think Tyler also, they've led Stickler teams in North Carolina and in DC. So great way to meet people. We are building this community, and you'll meet people not only with Stickler, but with our other conditions that really face a lot of the same challenges you do. So we do hope to see you during the year. I will be for sure in South Florida, and I will be in Tampa, Florida, and I will be in Northern California for sure. So those are places I'll be. But we have an incredible team, and you'll meet members of our staff everywhere. We have this sign up, and I know you guys all signed up for this webinar, but please also sign up for our emails and select your preferences. By doing so and indicating that your interest is in Stickler, you'll only get the Stickler information. You won't get information that's not relevant for you. We have our social media where we incorporate a lot of Stickler related information too. There's Teen Talk and Kids Club, which are basically virtual support groups, but they're for kids and teens, and they're not your typical support groups. They're fun and age appropriate for those age groups. We talked about sharing your story. My email is there, and you all should have that from emails that have gone out for this webinar. And you'll get another one from me tomorrow or the next day. So we do want to hear from you. We want to hear what matters to you and how else we can be of help. And these are the two platforms of two of our speakers. Life with Sticklers is Emily's Facebook group, and then Stickler Syndrome Italia is Irene's up, and there's Stella there. Hi, Stella. And you can see she's got 322 people, not just Italy, but all over the place. So another great group. You can see Stickler UK also is another great organization to follow. We all work together. We're all in this together. So follow everybody. Our next Stickler webinar is in January with Dr. Stephen Gowdy from Children's Healthcare in Atlanta and Dr. Elizabeth West Ellis from Vanderbilt. She's an audiologist. And they're really excited to talk to you all and share more information, more medical information, answer questions. Dr. Gowdy has been incredible. He's connecting us with more craniofacial experts, cleft palate specialists. So a really great champion for you guys. So I really encourage you to register for that webinar and join us there. And I think that wraps it up for us today. I want to thank all of our panelists, Taryn, who we can't see right now, but thank you for being here. We're excited that you're doing research, publishing research on this important topic. And a huge thank you to Tyler, Irene, and Emily for sharing your stories and just being there, not only for us, but for this entire community. So thank you all so much, and we will see you at the next one. Take care.
Thank you. Bye-bye.
Bye.
Bye bye.
Bye.